Well, good afternoon, everyone. Nice to see most of you in Tynwald this morning. Thank you very much for coming along today, and thank you for your professional reporting of the COVID-19 issue. As I said yesterday, the situation is fast moving and fluid. Getting the right information out to our people is and will be critical in the weeks and months ahead. You, the media, play a key role in that. This will be a team effort across the board. Thank you for what you've done so far. Yesterday at our press conference, I undertook to provide daily updates, and we will do so. You will be pleased to hear that it will not always be me. We want to use these press conferences to address issues that are new or questions that we feel need further clarification. Following our announcement yesterday, I made a statement to Tynwald earlier today. I updated Tynwald on the restrictions we are putting in place relating to people arriving onto the island from 1 minute before midnight tonight, the new powers we will be putting in place to be able to enforce this and to protect our population, the difference that people can make through high levels of hygiene and social distancing, and the need for us all to pull together as a community, stopping panic buying and supporting those who might be more vulnerable. The Treasury Minister also made important announcements about our support for businesses and the economy. I have asked him to do one of these press conferences, possibly tomorrow, to answer questions on that. But today I have asked the Minister for Health and Social Care. David also made a series of important announcements in Tynwald today, many of which will impact our people. The health and safety of our population is my top priority, and there has understandably been a number of questions that I know David is keen to address today. So over to you, David.
Well, thank you very much, Chief Minister, and good afternoon, everyone. Just to recap on some of the announcements that I've made today as Minister for Health and Social Care in relation to what we are doing to further our preparations for any COVID-19 situations that may occur in the island. We are in the development of a phone line, which will be the equivalent to the NHS 111 line in the UK, which people will be able to contact should they be displaying symptoms and feel that they need testing, or indeed if they need any form of advice that they want to seek around the situation they may find themselves in, such as self-isolation. Services are being prioritised across the hospital, and all elective surgery from today will be cancelled. That means that it will allow us to repurpose staff and train them up in other areas, particularly around ICU and isolation care, so that should any cases emerge on Ireland that require that, we have the necessary staffing in place. There are also changes being made to the emergency department, where we will create relevant isolation areas within the emergency department. So where the emergency department is now will remain as the main emergency department. The area that is currently meds will be repurposed as an emergency isolation area for them, and meds will move into palatine surgery. We are also asking that for low-level minor injuries, that from the 18th of this month, any of those people that present at the emergency department will be redirected up to Ramsey, to the minor injuries unit there, and equally anyone with minor injuries who may be considering presenting to the emergency department during the opening hours of the Ramsey minor injury unit, they should go up to Ramsey Cottage Hospital. We are also looking at all the patients we currently have in the hospital, and we're looking to prioritise discharges where it's medically safe to do so, and also people who might need step-down facilities who can be relocated up to Ramsey Cottage Hospital. One of the other announcements I've made today is that, as I've done several interviews with the press before, around the private patients unit, which we have been developing to get private services back on the island in June. I've taken the decision as Minister that at the moment is to be put on hold. That is because the private patients unit, which we've been working up to get back into service, holds a large number of individual rooms which can be turned into isolation rooms, and it's a sensible precaution to have that facility in place. I'm happy to take any questions.
Okay. Adrian.
Yeah, you said at the outset that it was very important to get the right facts out there, clear and unambiguous. But straight away that there was an issue with your comments about the over 75s having to go into self-isolation. That was what was said in the press conference, and the press release issued subsequently didn't say self-isolation for the over 70s. And actually, it isn't self-isolation at all that you're suggesting. The advice is to reduce social contact for the over 70s, pregnant women, for people with health problems. Pregnant women, by the way, weren't even mentioned at all yesterday, and as a father-to-be soon, I was very interested to hear that when I got back to the office. So we need to get clear, unambiguous information out there, and there was confusion. There's pensioners out there last night who thought they wouldn't be able to walk their dog. And, clearly nonsense, but that's what they got from the information about self-isolation.
Yeah, well, first of all, you started the question, Adrian, with saying it was over 75, so it's over 70s. Let's to be clear, and we were recommending that they look at forms of self-isolation. We're not going to be introducing it at this moment in time, but we were suggesting that those who are over 70, who maybe have an autoimmune illness or respiratory illness, or ladies who are pregnant, should consider elements of self-isolation. We're not bringing that in to force them to do that at this moment in time, but we are asking them to look at their daily routine. When they go out for a walk, can they keep a couple of metres away from people when if they're out and about walking? Do they go to events? That's what we were stressing. It was about thinking their lifestyle from now on, how they're going to help reduce the risk to themselves. If we feel the need in the future, we will be bringing in rules that force them to stay at home. They can go out into their garden, I hasten to add, if those rules are brought in, but at this moment in time, we are asking them to think about their isolation and ways of improving their lifestyle. So we're not saying they can't go out, but we're asking them just to think that extra about where they go, who they see, and the distance they keep from people. David, do you want to expand on that?
And I must say, I think what caused the confusion yesterday, and certainly from the people I've spoken to since then, was the announcement that came in the UK as well, which is much more stricter in the 4 months. So a lot of people were watching that on the evening news last night, and without perhaps fully listening to the nuances here, have thought that applies to them. In relation to the over 70s, personally, I thought it was clear yesterday that we were referring to those over the age of 70 that may have pre-existing conditions, that may put them more at risk, that they may wish to consider the isolation route. As the Chief Minister has just said, what we want the over 70s to do is consider what they do in their everyday lives. So the church fates, as I laid out yesterday at the press conference, should they, do they feel they still want to participate in that in the current environment? But there is no enforced self-isolation of the over 70s, and that was never the case yesterday either.
Okay. What's the advice on pregnant women then?
So it's the same for pregnant women in terms of social distancing, in that they should consider the events they attend, such as crowded areas, such as, for instance, do they want to be at mass gatherings? There is nothing enforced again. It is simply we are asking them to consider that they may wish to socially distance themselves. So, so small gatherings, a family, that's absolutely fine. But what we're saying is they may not wish to be in mass gatherings of people or crowded places.
But has the scientific evidence changed on the risk to pregnant women and the unborn child? I was aware there was no risk to unborn baby, but
there has been
that there could be.
There has been one case in the world of where there has been a transmission between mother and child, but it is not widespread. But again, this is sensible, precautionary thing. With most things medical, we advise with pregnant women, we see them as an at-risk group, and that is why we are advising social distancing. Obviously, it is up to the individual woman to make the final decision of what she feels is right for her, but we think it's important to get the message out there that we view that they should be taking up social distancing. And should be considering what they do.
Sure. Can you explain the 111 thing to us? Because we've done many interviews over many months, and you weren't having 111. It was go through meds, go through your doctor, whatever. Have you made this decision very late? I mean, is this something you have planned for a long time or not? And if so, is it working on the UK system? And can you put a bit more meat on the bones? And when will it be up running?
Well, Paul, I don't discuss things with the media until I know they're pretty much ready to go. You don't get any spoilers off me, I'm afraid, Paul. In relation to the 111, it will be similar to the UK. We have got access to the UK's algorithms that sit behind their service, and I would like to thank NHS Digital in the UK for sharing those with us. In terms of the service, I think now we're moving into a different phase. It is very, very important that we don't overload meds and the GPs who have a day-to-day job to do as well. We've got to remember. So it is important to have that dedicated helpline. We are working very hard to have the service up and running either by the end of this week or the start of early next week.
Do you think the Isle of Man is in a position to cope with the influx of students that arrived last night on the boat and on today's send from Heysham? Obviously, the self-isolation isn't enforced till tonight, and why wasn't it enforced straight away from the press conference yesterday?
Well, I'll start that one. You've got to give and have an enforceable time that you can enforce and operate efficiently. We needed to make sure that people knew when they were leaving to get on the boat, getting to the airport in the UK, that the Isle of Man was putting a date frame out, and if they arrive on the Isle of Man at 12 o'clock onwards from tonight, they are fully aware of the rules and regulations that apply. If we'd have gone straight away, we wouldn't have been able to put a system in place that was efficient. David, do you want to expand on that?
Things have got to be done in a managed way. The proclamation from the governor needs to be in place. We need to make sure that we have the powers that potentially can flow off that. There was no point just putting something in arbitrary that had no way of being enforced anyway. So it's absolutely crucial we do things in a managed and staged way, and that is why the decision was taken that we would actually enforce it from tonight. I must emphasise again that, of course, the self-isolation that we are going down is a precautionary measure, because unlike other jurisdictions, we have had no identified cases as yet on Ireland.
But everyone's heard about the school trip that came in yesterday from Tenerife or something. Everyone's talking about it, and they were some big school party. There's going to be a lot coming in on that boat tonight, as Mark's saying. I mean, they can just walk off that boat and go home without any checks or balances, correct?
Well, like I say, there's got to be appropriate powers put in place, and things do take time to organise. People would have been very critical of us if we rushed the fences, announced an immediate isolation, and then had no way of dealing with that. It's important that we had needed that 24 hours to get the processes in place. But again, I have to emphasise again, there's been no identified cases on the island. So what we are doing is precautionary and protective measures. Other jurisdictions are in a very different situation to us.
How much signage is there going to be at the ports of entry?
Can we do it through the chair, please, rather than just coming in? Please, Tim.
Sorry, yeah.
Thank you.
That's the question. What sort of signage are we going to have at the airport and at Douglas?
Public Health is working on signage. There will also be individuals as well at the ports to manage people coming off the planes and boats.
If I can just go back to the first question before we were interrupted. If you look at the UK, you'll see that they gave a couple of days' notice for some of the issues they were bringing in. So you will always have, if you put a time frame out, you'll always get people that come in before. And we've just got to accept that. But equally, they will all be made aware of the measures that if they show any signs, we will expect them to self-isolate. Sorry.
Well, so can I have an answer on the signage?
Yeah, so there will be appropriate signage put in place ready for tomorrow, because obviously with it coming in at 1 minute to midnight, it needs to be in place for tomorrow. That is being worked upon, and equally we will have people down at the ports and at the airport in order to answer queries for people.
Okay, 3FM and then yourself.
So in terms of the self-isolation, I guess quite a simple question, how do you go about policing and making sure that people are actually adhering to that? And if there is evidence that one person or numerous individuals are breaching that quarantine, what punishments or actions are considered to resolve that or neutralise the possibility that other people might be breaching that quarantine?
Well, our Attorney General is currently working on legislation powers to make it an offence, and we will enforce that strictly. If we get evidence that people haven't followed the rules and regulations of self-isolation, then it will be a criminal offence. We have implemented the 1936 Emergency Act, which I think the only time it has been implemented was 1939, so this is the second time since the war, World War II, that it's been brought in, and that will give us the powers to enforce the adherence of isolation, and if people don't, we will take action. And as there's 85,000 people on the Isle of Man who I think will be watching everyone's every move, so I'm pretty certain we'll have plenty of people who will be more than happy to come forward if people do break it. So I genuinely believe that the vast majority of the Manx public will follow the rules and regulations.
I have to say, I mean, we are a very responsible community here on the island, and I would hope that people will act responsibly, because at the end of the day, this is in place to protect them and their loved ones as much as anyone else. And for that very reason, certainly people I've been speaking to today have actually, although it's going to disrupt their lives, made quite clear they will be following the advice.
Okay, gentlemen.
I would just say, following on from that, in terms of the powers, are we going to go into sort of martial law kind of era on the Isle of Man? I mean, some have called them draconian sort of powers. Are there any sort of plans on the table if this virus escalates to move to that sort of level of escalation?
Well, first and foremost, we haven't gone down martial law. I think if you look at some of the countries in Europe and America, you may think they have gone down there. We have acted quickly to reduce the likelihood of a significant outbreak on the Isle of Man and to spread it if should that happen. We are hoping that every day-to-day normal life can go ahead as normal, because we've taken these decisions to cancel the TT local elections, the Douglas South by-election, and if we feel the need to bring in additional powers and further rules and regulations, then of course we will, but it will always be in the best interests of the people of the Isle of Man. David, do you want to?
And in terms of a technical answer to you, if you actually refer to Section 2 of the Emergency Powers Act 1936, you will actually find there is reference to disease and illness. So that is precisely why that particular clause is within the Act in the first place, so the government can act quickly and be able to put regulations in place without having to go through the usual process of extended secondary legislation. So it is there as a preventative power to protect the populace.
Okay, Tim and then Catherine.
You've mentioned that as much as possible you're wanting the message to go out that life goes on as normal. However, it isn't going to be normal, is it? Because there's so many events being cancelled. Even just as we've come in here, the Church of England are saying no church services. So life is going to be very different. So I'm just slightly confused as to why you're saying life goes on as normal. It isn't, is it?
Well, as normal as it can be when you've got a major virus outbreak around the world. If you look at the announcements that the Prime Minister has made, pubs, restaurants, clubs in London are shut down effectively. We've not done that because we're in Ireland and we're isolating people that are coming onto the island now. We feel that we can continue to enable people to carry on that sort of life. So yes, but some events.
They're telling us now that Mothering Sunday, where it's too like trying to find a hen's teeth, isn't it, to get a table in a restaurant. They're reporting that people are cancelling.
Well, that's right, and that's down to individuals' decisions, really. I was pleased to say that before we had to ask them. Gandhi's Circus have announced that they won't be coming to the island. That had been in my post bag, that they won't be. They're not coming to the island. I'd obviously had concerned residents about that. So events will be cancelled. That is a sad fact. But some form of normality where people can go out for a drink, to get a meal, restaurant, are still, the option is still there.
I mean, I think it's important to emphasise we are in the middle of what worldwide is a health emergency, and people will have to make short-term sacrifices for long-term gain. As an island, we are ahead of where all the jurisdictions are. Some of the announcements we've made yesterday are only just being followed by the UK today, who is in a very, very different situation with a full outbreak underway. We have taken preventative measures beforehand to preserve the quality of life of people on the island and allow people to, as much as possible, go around about their daily business as normal.
Okay, Catherine next.
In terms of the emergency powers and the ability to prosecute, how do those powers differ from the powers that you announced at the end of February, that will be at the end of February? And will it be a financial penalty you're talking about?
So in terms of the regulations that were announced at the end of February, they were in relation to people with symptoms who could be, who we suspected had the disease, could be forced to self-isolate. Because this is a precautionary measure, that is different. We can't necessarily have a firm ground to say that we believe that the person self-isolating does have the disease, but we still want to have the power to self-isolate them. So the regulations flow off the proclamation that the Governor has made. By making that proclamation under the Emergency Powers Act 1936, then regulations can be drafted by the Attorney General, which brings those powers of enforcement into force.
Okay.
Just a question on testing, really. I was wondering if there's been a change on how long it takes for tests to come back, because obviously it was 48 hours and it went to 72 hours. I'm wondering if it takes any longer now, considering what we've seen over the past few days.
At the moment, it's still 72 hours, I believe. I'll be perfectly honest, I think that time will extend out with what's being seen in the UK, but that is why one of my other announcements today is that we're looking to build the facility to be able to process the tests on Ireland, and we should have that up and running around about the middle of next month. But certainly for the UK microbiological laboratories, it is likely to be stretching out just from the sheer number of tests that will still be coming in, even although they've changed their criteria to hospital testing.
Okay. Paul, you're next.
Thank you. Respirators, 6 for 6 beds. Clearly not enough. I know you said you got some standbys somewhere from foot and mouth.
Swine flu.
Swine flu. I mean, on a serious note, how many do you need, and what sort of timescale? Because everyone else wants, of course. I mean, I know you say you got this arrangement with the UK, but you know, who's going to give up a respirator when they need them probably as much as we do?
Well, no, with NHS supply chain, we are treated as an equal partner. So we are provided on exactly the same basis as any hospital trust around the UK. But one of the things, and the international media seems to be spreading this myth that I need to finish off right now, is the fact that there is this assumption that any COVID-19 patient that requires a hospital setting will require ventilating. That's not the case. Exactly the same as any other virus or disease, different people present different symptoms. So if you look worldwide at the 6% that people would class as serious or critical, requiring medical intervention, though of those that 6%, only roughly 2% require any form of serious medical intervention, such as ventilation. The remainder simply need to remain in hospital in an isolation area and be treated according to their symptoms.
Yeah. So it's clearly a good thing that the Isle of Man has a reciprocal agreement with the UK NHS.
You do need more though, right? I mean, 6, if you hit the mathematics, which you've presumably done, 6 won't be enough. Do you know how many you ideally need?
Well, we've got different modelling that we actually have. We've modelled all various different scenarios. But I think the point is, the reason we've taken the actions we have, you keep hearing a lot in the UK about lowering out the curve. Because, again, what's got to be remembered is if an outbreak does occur on the island, we're doing that to ensure that we wouldn't get large amounts of people infected at once. And that's the point. It's about lowering out that curve and spreading it out so you don't get those peaks. So we don't get sort of what Italy has seen, where you get mass infection at the same time. That's why we've taken the sensible approach we have over the last couple of days.
Minister Ashford, you obviously announced yesterday with the increased community testing. Can you elaborate exactly more on what that is and exactly who you are going to be testing, as opposed to the UK model of only the most seriously ill people getting tested?
Yes, so ours will be on symptomatic testing, so people who are actually presenting symptoms. We will be looking to put up mobile units for testing, for people to go to for testing. I need to emphasise that will only be people who have been told to attend a unit. It's not randomised testing where people can simply turn up, because they do need to go through meds or GPs, or when we've got the helpline up, that first. But for those who are more vulnerable, particularly the elderly in the community who may not have the mobility, we will continue with testing in the home.
We'll be announcing that as soon as we can.